it helps, Steve, because NextGen Care is a big story. For years now, the market has been driving all of us to deliver higher levels of patient engagement and more coordinated care across patient populations. Truly achieving those goals is another thing again, especially when you're trying to coordinate data across multiple applications, multiple screens, and even multiple systems. Well, we've solved that problem. We've even given it a new name, NextGen Care. NextGen Care brings you significant new population health management capabilities. It also fully integrates into our existing ambulatory EHR, PM, patient portal, dashboard, and NextGen Share. So what does that mean? Now we can make point-of-care decisions and even manage an entire population of patients with just a few clicks.
So NextGen Care provides you a single point of access that allows you to proactively engage groups of patients, automate care management teams, assess clinical and financial risk, share data across enterprises, and gives you the data that you need for clinical decision making. What sets NextGen Care apart from the pack is you can do all of that from one place with very few clicks. So now, let's take a look at our new population management hub.
The Registry tab allows you to group patients either by demographics or by chronic disease conditions. We've pre-populated the registry with a robust starter set of predefined patient groups.
Drilling down to a specific patient gives you, or the care manager, a summary view of care opportunities for that individual.
From here, you can clearly see the actions needed to get this patient back on track. Medications, chronic problems, allergies, referrals. There's even a patient risk summary.
Well, let's talk about that risk summary for a moment. What does that figure represent?
It's a blend of clinical and financial information, one of the exciting new features of NextGen Care. We're partnering with Milliman, the leading vendor in healthcare risk stratification and scoring. The figure you saw represents our NextGen clinical data blended with CMS claims and payer data from Milliman. Having that mix of data is a powerful step forward for provider organizations. And I can't emphasize this enough because it gives you a more balanced view of that risk situation.
Now, meanwhile, back at the hub, since NextGen Care is fully integrated with the ambulatory suite, you have one-click access to the patient's EHR record, the PM chart, and the dashboards. And all of the data that you're seeing up here is patient context sensitive. So it's specific to Rodney Felix, the patient that we highlighted above.
So here's where it all comes together for me. Let's take a look at the all-new Care Coordinator report. Without even leaving dashboard, you get a dynamic view of all the risk factors for potentially avoidable costs needed to manage this patient's health, both clinical and financial.
Aha, so this is bringing into context some of those third-party claims and payer data we were talking about earlier. That's a radically new perspective on risk.
No one else has anything like this, Steve. So let's move on down the care action pathway. Recall lets me take a specific action for an entire group of patients. Let's say I want to reach out to all of my women over 40 who are due for mammograms. I can select all, apply the mammogram recall plan, and hit OK. That's it. I've just launched a recall notice for every one of those patients.
Now, what Message lets me do is reach one patient or group of patients with a one-time note, sending them a message in their inbox via our patient portal.
Then from Task, I can assign an action either to an individual or to an entire care team. The assignment flows right on to that new NextGen EHR workflow screen that we saw earlier this morning.
And here's a new feature that you're really going to like, especially you care managers. What Export lets you do is build out sub-list of patients that need follow-up activity and lets you share that list with work groups. So now, when members of that group log into My List, they'll see patients waiting for follow-up, and you can work that list to completion. It's a quick and great way for that morning huddle.
That's